Welcome to the Brain Standard Podcast, where I teach you how to change your brain, protect your future, and be a part of the generation that is going to end Alzheimer's and dementia. Before we start every podcast, I have to let you know that you can protect your brain, you can reverse cognitive decline, and it is much simpler than it may seem. Now let's jump right into today's episode. Hello and welcome to another episode of the Brain Standard Podcast. If you don't know who I am, because this is your first episode, my name is Tyler Bradley and I own Bradley Health. I'm a brain health coach and started that because my mom was diagnosed with early onset dementia at only 57. So I've made it my mission since then to change the standard of care in the brain health space, hence the name, the Brain Standard, of this podcast. Today's episode is going to be a little bit different than typical episodes where I'm going through kind of step-by-step instructions on how to change your food, on the burden of dementia, how we need to talk more about it. And it's going to be more geared towards the actual protocol that I run for those that are experiencing cognitive issues. The protocol this specifically is called ReCODE 2.0 protocol. If you want to learn more about it, just by going to a link, go to Apollo Health's website talking all about ReCODE. Now, this protocol was developed by Dr. Dale Bredesen and his team over 15 years ago, I think now at this point. And the protocol is designed as precision medicine. What is precision medicine, you may ask? It is a very detailed approach where you look at the blood work, the MRIs, the MOCA testing, the cognitive scores, and really dial in each individual person's plan based on the leading root causes of why they might be experiencing cognitive symptoms. And so we're going to talk about that today using one of the clinical trials that they did in 2022 on just a few patients, because it does a really great job of outlining the actual treatment that they went through. And so we're going to start off by going through the actual methods that they used for getting these patients and treating them in the trial. And then we're going to go through kind of the outcomes that they experienced because of the precision medicine that was actually used. So let's jump right into it. First of all, the trial had 25 patients with either dementia or mild cognitive impairment. Now, mild cognitive impairment is just kind of a lead-up diagnosis to Alzheimer's and dementia. And really, mild cognitive impairment, in my opinion, when diagnosed by a neurologist, could just be considered early Alzheimer's or early dementia. But in this situation, you can actually change your outcomes. Especially the earlier and earlier you're starting to catch these issues that you might be experiencing, your loved one might be experiencing. If you catch them early and start a protocol like this, the data speaks for itself, which we'll talk about towards the end. And in fact, this is kind of an older study. There's a newer study done last year that has even better results. So they had these 25 patients come in. They all had cognitive testing. They all had MRIs. The cognitive testing was done at the very beginning as a baseline and 3, 6, 9 months. Same thing with blood work. Everything was kind of taken into account in understanding what their blood work looked like, what their tox testing looked like, what their cognitive scores were. And they did an MRI at the beginning and at the end to see like how their brain had either grown or shrunk or atrophied or whatever that the specific person had going on within their brain. The actual treatment protocol and the method that actually goes into this ReCODE approach is very specific person to person, hence the term precision medicine. Now, most of the people in this program were 50 to 75 years old. Actually, all of the people, not most of the people. That was the criteria to actually get in. The cognitive scores I'm not really going to go over because they likely won't mean anything to you, but there was exclusion criteria if the score was below a 19 for MOCA specifically, and they excluded these people in the test because that is a much lower score than what they could technically like work within the clinical trial realm for this specific trial. And so the cognitive scores range from a 19 to 26 within the MOCA assessment. And if you want to understand that a little bit more, you can look up what those scores mean. But the treatment specifically started by understanding each person's root cause of why they might have been declining. And there's a few different root causes that you can look for. One being a toxic burden of Alzheimer's. And this can come from mold toxin, mercury toxin. Those are typically the two most common, a blend of multiple different mycotoxins going on in the system. And then you've got inflammatory type dementia, which can be considered the most common just because inflammation causes the majority of dementia and Alzheimer's cases in multiple different scenarios. And so this inflammatory marker could be, brain inflammation, being the main driver. This gets diagnosed typically through MRI to understand exactly what's going on inside the brain, and then blood work as well. You can see the things like hsCRP, which is like an inflammatory blood marker, and if that's really high, there can be an understanding that there is a high amount of inflammation going on in the body and in the brain. And then you've got, say, type 2 dementia, which is going to be the atrophic type of dementia. So the brain is actually shrinking, and that shows up on the MRI. Again, an MRI is used to diagnose that. Or it could be what they kind of call type 1.5, which is glycotoxic, essentially super insulin resistance. This is, think of like the diabetes patients who have really poor insulin resistance, and they have really bad blood sugar issues. It's called glycotoxic because the blood sugar essentially is creating a massive environment in the brain where it just cannot intake the right amount of fuel, and therefore it gets really, really inflamed. And that's like diabetes of the brain, essentially. And there's a couple of more. Trauma-induced is a big one. Vascular dementia is a big one. And all of those, once you understand what's driving the actual decline, then you can start implementing this ReCODE treatment to fix it. And when you're in the ReCODE protocol, like a couple of my clients are on this ReCODE protocol in the ReCODE app and getting a ReCODE report, it shows them based on their blood work that they get through the brain scan blood work that ReCODE and Apollo Health actually do, and then the MRI and whatever else other data they have. You'll get a ReCODE report showing exactly what areas are most likely the causes of your actual decline, or your parents' actual decline, or your loved one's actual decline, whoever you're listening to this for. And so once they have that ReCODE report, then they're able to pinpoint, okay, it's mycotoxin based, which is mold toxin. So let's attack this toxic type of dementia with the right protocol. Or it could be inflammation and blood sugar based. And so we can tackle with a very metabolic approach to fix those. Many times it's a mix of multiple. And so you have to go very specific with the precision medicine protocol to do this. The treatment team in this actual clinical trial included a health coach, which is what I am, nutritionist, and a personal trainer. And so they provided all of these people within the program to the client. And they did this because the outcomes are much better when they have health coaches, nutritionists in their corner, personal trainers. All these people, one, are going to hold them accountable, but two, give them a step-by-step, like, here's how to do what's next within the program. Here's how to eat. And then, of course, the most important, the physician, the person who's actually running the ReCODE protocol and able to run all these tests and kind of help diagnose and understand exactly what's going on. The first big part of the ReCODE protocol is going to be the diet. So the diet is typically very high in plants, high fiber, soluble and insoluble fiber plants. You can think of pretty much any vegetable is going to be really important in the diet. High in leafy greens and other non-starchy vegetables, either raw or cooked. And the diet we want to be mildly ketogenic. And they typically call it keto flex because it's not a straight keto diet. We're not trying to massively spike up fats and completely cut out carbs for an extended period of time. The goal is to fix the metabolism using this keto flex diet. So using ketones to, one, feed the brain, because the brain, if it's not working properly, especially in the glycotoxic type Alzheimer's, it can't intake glucose the right way to provide its own energy. And so we need to give it another source of energy, which is going to be ketones. That's why we want a mildly ketogenic diet, to produce the right amount of ketones to start giving the brain energy in order to heal. Outside of that, we also want the metabolism to start healing. And in order to do that, we kind of need to pull out and give the body some time to kind of repair the insulin receptors, its ability to utilize blood sugar, and then we need to utilize ketones for energy in that way. Ketones are also going, if your ketones are being produced, we're also going to be taking out inflammatory fats out of your body. And so we need to make sure we're producing at least a little bit of ketones. It's very high in fats because of this, but unsaturated fats. So people weren't eating high amounts of red meat. People weren't eating extreme amounts of eggs. It was mainly fats coming from high omega-3 fatty acid fats. So olive oil, wild caught, low mercury fish, think smash. So salmon, mackerel, anchovies, sardines, herring. and the eggs were kind of the modest amount. Meats were encouraged, but like people weren't eating meat as their main source of these proteins, because you need the omega-3s and less of that saturated fat or unsaturated. No, sorry, saturated fats. The unsaturated fats were higher. Everything else was kind of low in glycemic load, hence the effect on the blood sugar. So that's why the high fiber plant rich diet was important, and that was where mainly the main amount of carbs were coming from. And with that, people were avoiding processed foods, simple carbohydrates, all gluten and dairy. Blood ketone levels were monitored throughout this clinical trial, which I do for myself a lot of the time. I have clients that are going through this keto protocol to do, because we need to understand if your body is responding in the right way to produce those ketones. Because if we remove all carbs and your body does not start producing ketones, you're going to be very low on energy. And so we're really trying to make that happen. Typically, it's a finger stick using like a Keto Mojo is what the recommended one is. And it measures blood glucose and ketones at the time of measurement, so that you can understand exactly where your body is at with that. And so with the diet, it needs to be plant rich, high fiber plants. Soluble and insoluble fibers are what you want to get. Mildly ketogenic using wild caught fish, pasture raised eggs, meat low in saturated fat. So like the leaner the beef, say, the better. Chicken is a really good source as well. And then avoiding processed foods, simple carbohydrates, gluten, and dairy is really, really important in the diet. Now, exercise, it's, people in a lot of realms are like aerobic, which is cardio, or strength training. Like, what do? You need to do both. And that's what people on this protocol were actually running. Was encouraged for 45 minutes per day, at least 6 days a week, which, dependent on where you're at with your cognitive issues, if you don't have any cognitive issues, you're just looking for prevention, it does not need to be so intense with the 45 minutes, 6 days per week. Is that ideal? Yes. And what you can do in that sense is strength training twice per week, aerobic exercise twice per week, where your heart rate's getting a little bit higher, and then the other 2 days just getting in some low intensity walking, slow biking, things like that. But these clients in the protocol were doing 45 minutes, 6 days a week with aerobic exercise, and then twice per week for strength training. And then high intensity interval training was actually recommended a minimum of twice per week within the program as well. But some people cannot do high intensity interval training, just depending on what their body is capable of. So that can be, taken with a grain of salt. The big thing is going to be just the movement with the aerobic exercise, and then the strength training is really, really key. So at least twice per week on the strength training. And if you're just starting out, does not need to be 45 minutes. Going in with the mindset that you can do like a minimum of 10 minutes is fantastic, and you can build up from there. Sleep was the other big pillar within this protocol. Sleep hygiene was supported pretty heavily to work these clients to getting 7 to 8 hours of quality sleep per night. Patients with sleep apnea were tested before and throughout the protocol to make sure that their sleep study devices were actually being utilized properly, so that they could get rid of the sleep apnea throughout the program. And this is going to be one of the big things that a lot of ReCODE participants actually end up running into, is that they have sleep apnea that they didn't really know about. Even a slight bit of sleep apnea that typically wouldn't get diagnosed is an issue when it comes to healing the brain, because sleep is so important. And not just sleep, but getting enough air in at night is really, really important. Even a slight drop in oxygen is going to affect the brain, especially night after night after night. And so sleep apnea is really, really important to fix, especially as you get into the ReCODE protocol. And so a CPAP machine or a dental splint was used for those identified with sleep apnea or the upper airway resistance syndrome, which was also listed in here. So we need to make sure you're getting enough sleep. To do this, a lot of my clients are doing breath work right before bed. If they run into stress, especially, they're doing breath work right before bed. But a lot of your sleep comes hours before as you start exercising. That's going to put your body in a state where it wants to recover. It wants to go to sleep. If you're doing the breath work before bed, it's going to switch over your nervous system from the fight or flight to the rest and digest. Eating your last meal 3 to 4 hours before bed is also going to help you sleep, because you're going to not be digesting food. Your body's going to be able to focus on that recovery. A couple of supplements that I recommend right before bed: magnesium glycinate is really, really great, along with L-theanine, sorry, I was going to say magnesium threonate. And so you can also do magnesium threonate, which crosses the blood-brain barrier a little better than magnesium glycinate. It's just a little more expensive. And so whatever your price range actually fits is going to be fine. And so pairing those right before bed is really positive and shown in studies to improve sleep. And so that's a really good place to start. Stress management, like I just mentioned, was another big pillar within the actual ReCODE protocol. And whenever they were managing stress in the study, it included biofeedback. So daily they were tracking how their stress was being handled. Heart rate variability is another big one for stress. And they were actually doing heart rate variability training with this app called HeartMath Inner Balance. So you can use that on your phone for a minimum of 10 minutes per day. And that was chosen because it was easy for patients to actually use. And so there was a high compliance. And so if this is an issue that you run into with stress, breath work, box breathing is my favorite breath work for my clients to do. And I would highly recommend everybody do that for at least 2 minutes a day for like a week and just see how you feel after doing the breath work. That's going to regulate your nervous system, get your heart rate lowered to, it's supposed to lower it to like 60 beats per minute on average. That's obviously not going to happen for every single person. But then if you want to do this HeartMath, you can download that on your phone. And so look up HeartMath in the app, or you can use an app like Headspace or Calm to work on that mindfulness approach. But stress management was really, really key within the protocol as well. And those are kind of the 4 big pillars. So diet, exercise, sleep, and stress. And if you're able to manage those alone, you are going to see massive improvement in prevention of Alzheimer's and dementia, how you feel day to day, how you're functioning day to day, and how you age. Now, if you're someone who's diagnosed with MCI, subjective cognitive impairment, SCI, or an actual Alzheimer's dementia diagnosis, or you're watching for somebody, this needs to be dialed in very, very specifically. And so going to that ReCODE site, reaching out to me so that I can help you understand where you're really at and get you within that program is really going to be the most important thing that you do. Now, some accessory pillars that go along with this. Brain training is actually really, really key. It was carried out using an app called Brain HQ, which I use myself sometimes, and Brain HQ is fantastic. It's actually one of the only brain training apps that have been used in trial and has a clinical trial to go along with it and shows improvement over time for so many people that are actually using it. The participants in this specific study were trained on 29 different cognitive exercises that target speed and accuracy of information processing. And so it's going to help the brain learn, build new synapses, and continue to grow even with a cognitive decline diagnosis. And then we can get into things like hormone status. So women in menopause, men who have really low testosterone, bioidentical hormone replacement, and appropriate supplements were provided to optimize sex hormone levels. And this is shown to drastically increase cognitive function. For disclaimer, I'm not a doctor, I'm a health coach. I cannot tell anybody to utilize hormone replacement. So you need to talk to a doctor or your practitioner about that specifically. But in the studies, I can talk about that. It is shown to increase cognitive function. So keep that in mind. Talk to your doctor if you feel like that might be a good fit for you. Thyroid medication, as used for those with suboptimal thyroid function. So everything was tested. And then for those with suboptimal nutrients, the appropriate nutrients were provided, likely in supplement form. And then we can look at gut health as well. And this is where it comes down to precision medicine, because we can go deeper and deeper and deeper in this hole, right? We can continue to look at the next thing and the next thing and the next thing that can be optimized in order to heal the brain. And when it comes to people with an actual cognitive decline diagnosis, this is what it takes. But I'll get into the results in just a second, because this might seem like a lot, but compared to the alternative, I would rather go through this every single day of the week than go through the alternative. So we got into gastrointestinal issues like hyperpermeability, so leaky guts, infections, inflammation, dysbiosis. And all of those were worked with with the health coach and the nutritionist to start healing. Those with some systemic inflammation were given anti-inflammatory herbal supplements, were given injections or infusions with things like glutathione. Resveratrol was really important in that to decrease the oxidation levels, decrease inflammation, hence the excess antioxidants being given. While being given this, the fast fasting mimicking diets or actual fasting was utilized in order to decrease inflammation and increase autophagy within the study. And then if tox type Alzheimer's was apparent in some of the actual patients, they went through the process of the detox protocols, which are very targeted. And I'm not going to get into because they're very complex. But if you suspect that you have a mercury toxicity, mold toxicity, or you've been told that that's the case, a detox protocol that is effective is going to be really, really key there. Now, looking at the actual results, which is kind of the big driver of why you want to learn about this and potentially do it for your own brain. Metabolic effects were the first big results that they reported. A significant reduction in inflammation was observed in HSCRP, that the inflammation kind of blood marker that I talked about. There was a significant reduction in A1C as well, which is kind of what is used, and you probably know what A1C is, to look at how your body handles glucose, which is what is used typically to diagnose diabetes. And then outside of that, people, if they needed to lose weight, were losing weight effectively. Lipid profiles were observed as dropping down to optimal levels, and there was a significant increase in vitamin D within people's blood work within the program. And so the metabolic effects are systemic. They go across the body and outside of just your cognitive function. And this is mainly looking at protection for the future. Your body is going to feel so much better and operate so much better by doing a protocol of this nature. Now we can look at actual cognition and understanding how people improved in their data. So we talked about the MoCA as kind of the baseline at the very beginning, and the scores ranged on average anywhere from 19 all the way up to 26 were kind of the lines there. As the progression went on throughout the entire study, by the end of the 9 months, the range was 30 to 19, but the average up here, because the 19 was an outlier when looking at the chart, the average was right around 27, while the average at the very beginning was 23. And so there was a strong increase within the MoCA scores within that 9 months. But the big discussion down within the protocol was actually looking at, let me switch over here so I can give you the right information. The actual increase within the protocol within all of the clients, 84% of people improved within their MRIs, within their blood work, and within their cognitive scores on the testing that they did. 4% had no change, and then 12% continued to decline. And so you can see, based on just that number, 84% alone, now there were only 25 people in the study, but this new data that came out, which is linked in the description of the YouTube video or the whatever platform you're on, is going to show you the new randomized control trial that came out with many more people in the study, and it just came out in January. And I highly recommend you go read that one because it is significant in its data, because the same amount of people improved in the ReCODE protocol, but there were more people in this trial. So 84% of people improved in this specific one. When you look at this compared to no treatment or the drugs that are used currently for Alzheimer's and dementia, this is the only one that where people improved. Precision medicine protocol is the only protocol that's been studied where people actually improve and have an improvement in their cognitive scores. When you look at even like the drugs that are coming out in the last couple of years, the donanemab, lecanemab, people do not improve. It just slows progression, which is fine. But I am of the thought that we can improve people's life, improve people's brains, no matter what stage they're at. And that kind of covers everything within the trial. Now, there is more to the ReCODE protocol, but I covered the big basics that they did in this trial. If you want to learn more about it, you can send me a message, you can drop a comment, and I'll get back to you on it. But if you want to go to Apollo's website and read more about what they have going on there and the ReCODE protocol, it's linked below. The clinical trial I talked about is linked below. And then my own guide, 15 Daily Steps to Heal Your Brain, which takes a ton from this ReCODE protocol, is also linked below that you can grab. I'm going to wrap it up here because I've been blabbering on about the ReCODE protocol for a long time. But thank you so much for watching. If you have any questions, I'm here to help you. And I hope that you learned a lot today. I hope to see you in the next one. This has been the Brain Standard Podcast, and I truly thank you for listening. I hope after listening to this episode, it might light a fire inside of you to really take charge and control of your brain's future. And if you found it useful, maybe share it with a friend, follow the podcast on whatever platform you're listening, and I'd really, really appreciate a 5-star review. And for more information, all you have to do is visit bradleyhealthcoaching.com. I have a couple of resources on there, or you can book a call with me and figure out how to take the next steps in taking care of your brain. Thanks so much again for listening, and I'll see you on the next episode.